Hi, I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on sports and exercise injuries for athletes and active people, probably much like yourself or maybe your kids, so that you and your kids, your friends, can stay healthy and perform your best. Now, I, as an orthopedic surgeon, see thousands of people every single year in my clinic, in my office, where I'm basically examining people and listening to their injuries after shoulder injuries and knee injuries, maybe ankle or foot injuries, whatever it is. And a lot of times one of the questions that I get is, how much I can figure out what the injury is just by talking to somebody and just by doing a physical exam. Yes, we get x-rays a lot of the time, we get an MRI some of the time, but a lot of times we can make a diagnosis or have a really good idea of what the diagnosis is just by physical exam. And so in today's Ask Dr. Geier video, I'm going to address how well we can make specific diagnoses after a serious knee injury. How well does physical exam predict what an MRI would actually show? Christina B. asks, "Hi Dr. Geier, I was told that a lot of the ACL injuries are not isolated injuries. Almost half the time, people have also torn the MCL or meniscus at the same time they tore their ACL. Without an MRI, would an orthopedic surgeon be able to get a full picture of all the damage in the knee? Are there tests to determine the MCL and meniscus damage as well? I'm currently on a super long waiting list to get an MRI. It would be nice to hear your opinion. Thanks." Okay, that's a terrific question that Christina asks, and she's absolutely right. Not uncommonly, we get MRIs to evaluate a serious knee injury, especially if we suspect an ACL. I saw two patients yesterday where I was suspicious of an ACL. One, I was so confident of that by physical exam, we're not even getting the MRI, we're going straight to surgery. We talked about surgery and non-surgical options. He wants to proceed with surgery, but I'm confident that he has an ACL tear, so we're getting an MRI. And at the time of surgery, I'll be able to look in with the scope and see any other damage, like a meniscus tear, that I could take care of at the time. So in his case, at least, I don't need an MRI. The other patient, it was a lot harder to get a good exam because his knee was really swollen, his muscles were firing, or what we call guarding, so protecting his knee, so I couldn't get it loose enough to truly tell if there was an ACL tear, so we're getting an MRI in his case. Now, what Christina asks is about the other tests. Obviously, physical exam, usually either if you're lucky enough to examine somebody in the first hour or two after the injury, so team doctors and athletic trainers can make that diagnosis, or about 7 to 10 days or longer after the injury, after the swelling's gone down, after the muscle guarding has stopped. A lot of times by physical exam, you can tell by a Lachman's test, which is basically a test where you pull the tibia up against the femur and show that that ACL is basically not doing what it's supposed to do. You can tell that the ACL is torn. There's also a move called a pivot shift test where you sort of make the knee buckle, and that can definitely tell you if there's an ACL tear. Now, she asks about an MCL injury. That's the medial collateral ligament. That's the ligament on the inside of the knee that provides side-to-side stability of the knee, very commonly injured in sports. Yes, there's a different test where you're basically you're moving the ankle out to the outside while you hold the femur still, trying to open up the inside of the knee. And very often you compare it to the good knee, and if it opens more than that good knee, then you are highly suspicious of an MCL injury. Along the same lines, a meniscus tear, a lot of times you can find very specific point tenderness either along the medial joint line on the inside of the knee or the lateral joint line on the outside of the knee, and they'll hurt right along the area where there's a meniscus tear. You can also, assuming that you can bend the knee enough to basically, where it's bent maybe 110, 120 degrees, and then you can rotate the tibia. This is a test is called a McMurray's test. You can recreate the sensation of a meniscus tear because, again, it's that twisting motion with full flexion. And a lot of times that's how you tear the meniscus, but that can also be basically how you make it hurt. It's a provocative test, and so that can definitely clue you in that there's a meniscus tear. None of those tests, at least for the MCL or the meniscus, would guarantee that you have an injury. I guess if the knee opens significantly, you'd be pretty confident of an MCL injury, but it certainly clues you in that there's potentially a problem. And again, if you're confident that there's an ACL tear by physical exam, a lot of times we'll skip the MRI because again, you would see the MCL at the time of surgery. When you do an exam under anesthesia, you'd see a meniscus tear when you scope the knee. So if you're wondering sometimes why your orthopedic surgeon, especially if he has a background in sports medicine and does a lot of ACL reconstructions, says you don't need an MRI, it could be that he's very confident there's an ACL tear and is trying to save you the money or save you the time and potentially go straight to surgery. Is there a real risk with an MRI? No, I mean, it's certainly going to put all the information on the table, but there is the cost and the time associated with getting the MRI. Now, have you suffered a serious knee injury and did your doctor get an MRI to find out what was going on? Or did he or she basically tell you, hey, look, I think you tore your ACL, or I think you tore your MCL or your meniscus just by physical exam? I'd love to hear your experiences, and I bet other people watching this would love to hear what you think as well. So below this video, leave your comments, leave your experience. It can help other people, basically trying to overcome a serious knee injury. It might give them a better idea of what to expect as well. And if you know somebody basically dealing with a serious injury right now, I'd really appreciate it if you'd share this video with them so that it can help other people going through the same problem. Now, if you like videos like this and want more information on sports injuries and exercise injuries, subscribe to my video channel. I record a couple of these videos every single week, and I'd love to share those directly with you. And last, go to my website, drdavidgeier.com. At the very top of the page, you can enter your name and your email list. There's so many resources that I share, audio resources, video resources, written, that they're on ways to stay healthy and perform your best that I only share with my email list, and I'd love to deliver those directly to you. It's completely free, and I think I'd really love to connect with you that way. Okay, I really enjoyed talking about this. I hope this video was helpful for you. Again, please share or please comment if you're going through a serious knee injury, and I look forward to connecting with you right here next time.